What do you know about pneumonia? Let's dive into it. Pneumonia, a word that rings a bell in every corner of the world, is an infection that inflames the air sacs in one or both lungs. These air sacs, also known as alveoli, can fill up with fluid or pus, causing a myriad of symptoms such as cough, fever, and difficulty breathing. Globally, it's a significant health issue, affecting millions of people each year. The impact isn't restricted to just the individual. It can ripple through families, communities, and even entire healthcare systems. Regardless of age, gender, or geographical location, pneumonia does not discriminate. It can affect infants and the elderly, the healthy and the sick, those living in urban areas or remote villages. Its presence is felt worldwide, posing a threat to public health everywhere. Pneumonia is a serious health issue, but what causes it? Pneumonia is caused by various microorganisms, including bacteria, viruses, and fungi. Each of these microorganisms brings its own unique set of challenges to the body, leading to a variety of pneumonia types. The most common bacterial cause is Streptococcus pneumoniae, while viruses such as influenza and respiratory syncytial virus are also frequent culprits. Fungi, though less common, can cause pneumonia, particularly in individuals with weakened immune systems. Now let's talk about how these tiny troublemakers get around. Transmission primarily occurs through airborne droplets. This means when someone with pneumonia coughs or sneezes, the microorganisms can be sent into the air and inhaled by people nearby. But it's not just about being in the same room with someone who's sick. These microorganisms can live on surfaces too. If you touch a contaminated surface and then touch your face, you're giving these invaders a free ride into your body. Now that we know what causes pneumonia and how it's transmitted, let's delve deeper into the different types of pneumonia. Pneumonia can be classified into different types based on the cause, location of infection, and how it was acquired. Community-acquired pneumonia, the most common type, develops in people with limited or no exposure to medical institutions or facilities. Hospital-acquired pneumonia, on the other hand, occurs in hospitalized patients, often being more severe due to resistant bacteria. Aspiration pneumonia arises when food, saliva, liquids, or vomit is inhaled into the lungs. Each type of pneumonia presents with different signs and symptoms. The signs and symptoms of pneumonia can range from mild to severe, depending on the type of pneumonia, the person's age, and their overall health. They often mimic those of the common cold or flu at the onset, but as the infection progresses, these symptoms become more severe and specific to the lungs. One of the primary symptoms is a cough that may produce phlegm, which could be clear, green, yellow, or even blood-tinged. Fever is another common symptom, typically accompanied by sweating and shaking chills. Difficulty breathing or shortness of breath, especially when you're doing simple tasks like walking upstairs, is another telltale sign. You might also experience chest pain that worsens when you breathe deeply or cough. Other symptoms can include fatigue, loss of appetite, or confusion, especially in older adults. Remember, these symptoms can vary in intensity. If you suspect someone has pneumonia, what should you do next? Investigating pneumonia involves a combination of physical examination, medical history, and diagnostic tests. To get a clear picture of what's going on, doctors often start with a physical examination. Listening to your lungs with a stethoscope, they're on the lookout for abnormal sounds like crackling or wheezing, which could suggest pneumonia. Next, your medical history plays a crucial role. Have you been exposed to certain environments or individuals with pneumonia? Do you have any underlying health conditions? All these factors can help paint a clearer picture. But to confirm the diagnosis, we turn to diagnostic tests. One of the most common is a chest X-ray. This provides a visual snapshot of the lungs, revealing any areas of inflammation or infection. However, it doesn't identify the type of organism causing the pneumonia. That's where blood tests and sputum tests come in. A blood test can confirm an infection and might even hint at the type of organism behind it. Meanwhile, a sputum test examines the mucus coughed up from your lungs. It's a bit less pleasant, but it's valuable for identifying the specific bacteria or virus causing your pneumonia. Once we've identified pneumonia, what's next? Treatment, of course. The specifics of your treatment depend on the type and severity of your pneumonia, as well as your overall health. For bacterial pneumonia, antibiotics are the go-to. They can be life-saving, but it's crucial to take the full course even if you're feeling better. In addition to antibiotics, rest and hydration are key. Your body needs energy to fight off the infection, so don't skimp on sleep. and staying hydrated helps loosen up the mucus in your lungs, making it easier to cough up. For more severe cases, hospitalization might be necessary. This allows for closer monitoring and access to supplemental oxygen or breathing treatments if needed. Remember, every case of pneumonia is different, so treatment will be tailored to your unique situation. That's why it's so important to consult with a healthcare professional if you're feeling unwell. But how can we differentiate between the types of pneumonia and what are the possible complications? Differentiating between the types of pneumonia is crucial for appropriate treatment. Each type has unique characteristics, often distinguishable by symptoms, cause, and location of infection. For instance, bacterial pneumonia typically presents with high fever and productive cough, while viral pneumonia might involve a lower fever and dry cough. The cause can also hint at the type, as certain bacteria or viruses are known to cause specific kinds of pneumonia. Lastly, the location of infection can offer clues. Community-acquired pneumonia occurs outside of medical or institutional settings, while hospital-acquired pneumonia, as the name suggests, develops in hospital settings. But pneumonia is not without its complications. It can lead to serious conditions like lung abscesses, where pus collects in the lung, or even respiratory failure, a life-threatening situation where the lungs can't provide the body with enough oxygen. So how can we prevent pneumonia? Vaccination is a powerful tool, especially for those at higher risk, such as the elderly and people with chronic diseases. Good hygiene practices like frequent hand washing can also help prevent the spread of infectious agents that cause pneumonia. And let's not forget the importance of a healthy lifestyle. Regular exercise, a balanced diet, and adequate sleep can strengthen your immune system, making you less susceptible to infections. Knowing about pneumonia is the first step towards prevention and appropriate treatment. So, what have we learned about pneumonia today? We've defined it as an infection inflaming air sacs in the lungs. We've discovered how it's transmitted and explored its various types. We've recognized its signs and symptoms and highlighted the importance of timely investigation and treatment. We've differentiated between the types, discussed potential complications, and emphasized the importance of prevention. As we've seen, understanding pneumonia is crucial. Stay informed, stay healthy, and remember, knowledge is the first step to prevention.